Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Wafatul Kulub. I want to give you news. Okay, more than half of maternity units in England fail consistently to meet safety standards. BBC analysis of official statistics shows health regulator, the Care Quality Commission (CQC) rated 7% of units as posing a high risk of avoidable harm. A further 48% require improvement. The figures are slightly worse than a few years ago, despite several attempts to transform maternity care. The reviewer says the pace of improvement has been disappointing. In most cases, pregnancy and birth are a positive and safe experience for women and their families, says the CQC. But when things do go wrong, it is important to understand what happened and whether the outcome could have been different. Laura Ellis lost her newborn son. She checked out the CQC rating of her local hospital, Frimley Park, when she was pregnant. Maternity services were good, but Laura did not realize the unit had been told that it required improvement on safety. She went into labor after an easy pregnancy and got to the birth center around 16 past 40. But within an hour, it became clear that the baby was breech, meaning that instead of being hit first in the womb, the latch or button were down, making delivery harder. Laura remembers that there seemed to be a complete sense of panic in the room and that no one seemed to have any idea what they should be doing. Just after 80 o'clock, the baby's leg uh, and chest has been delivered, and the midwife said she could feel a heartbeat. But a few minutes later, a senior midwife tried to listen for it with a stethoscope and could not hear anything. Laura says she was told that the stethoscope was broken. When her son Theo was fully delivered at 18 past 13, his heart had stopped beating. Medical staff tried to resuscitate him. At one stage, the oxygen canister used on Theo ran out before being replaced. Laura and her husband James watched, slowly coming to the realization that their son was probably not going to survive. Doctors and midwives stopped resuscitation after 39 minutes. Laura described Laura described Theo as the most perfect baby, just absolutely beautiful. It was just so hard to deal with, so hard to live as well. How how would you leave your baby in hospital when you should be taking them home? Frimley Park NHS Foundation Trust says it is extremely sorry for what happened. It says it has made a number of changes since Theo died, including an emergency response if a baby is unexpectedly breached during advanced labor. Okay, that's from me. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.